Hello there. My name is Doctor Reda, and I will be your doctor for today. Your name is Mita, correct? Sleepy Mita? Great. And should I call you Sleepy or Mita? Raise one hand for Sleepy, raise your other for Mita. Sleepy or Mita? Sleepy? Okay, Sleepy. Welcome to the clinic. So, I hear that you have a bit of issues today. Could you point and tell me what issues you're having? So, your head hurts. Okay. And is there anything else that hurts? Okay, great. So, there could be a myriad of reasons why your head hurts. The first could be a concussion, second could be a migraine. So, we're going to give you a thorough exam to look over and see what's wrong, okay? So, I'm going to ask you a few questions, and I would like you to answer it. If it's a yes, just raise your hand. If it's a no, just keep your hand down, okay? Great. So, are you active? Do you work out? Good. Okay. Have you been traveling recently? Great. Do you drink alcohol? Good. You drink? How often do you drink? Do you drink once a week, twice a week, once a week? Okay. And do you smoke? No. Okay. You do smoke. How often do you smoke? Twice a week? Twice a day? Oh. Okay. And when you notice pain, did it start in your ear or did it start in your head? In your ears. Okay. And when it was in your ears, was it a ringing pain, a dull pain? One for ringing, two for dull. It was dull. Okay. And when you discovered that pain, did it last very long or did it radiate to your head immediately? If it radiates to your head immediately, please put both of your hands up. Okay, it radiates to your head immediately. And would you say that this pain started recently or has it been a long time? If it's recently, put one hand up. And if it's been a long time, put both hands up. Recently. Okay, so we're going to do a couple of tests on you today. And the test will be to examine your head and your functions. And we call this an ENT exam. Okay, and with the ENT exam, we examine your ears, nose, throat. I'll also examine your eyes as well, just to make sure that everything's working with that. Is that all okay with you? Great. After we do the ENT exam, we'll also do a cranial nerve exam just to assess everything in your head. So we'll be doing a few different exams. And have you ever had a cranial nerve exam before? Okay, so we'll be testing a bunch of different things. So let's start with the ENT exam. When I do the ENT exam, what I'm going to be doing is I'm going to look into your ears. I'm going to test your hearing. And then after I do that, I'll just look into your nose and your throat. Is that okay? Great. So let's begin the ENT exam. I am going to say some words on different sides of you, and I want you to tell me if you hear the word. If you hear the word, please raise your hand, okay? Here we go. Did you hear that? No. Okay, what about this? Candy. Did you hear that? Great. Soda. Did you hear that? Okay. Ice cream. Did you hear that? Okay. Cheerios. Did you hear that? Good. Lollipop. Did you hear that? Okay. All right. So now what I'm going to do is I'm going to play a sound in your ears. I'm going to make a sound. And I would like you to tell me if you hear the sound or not, okay? Great. So I'm going to start with your left ear. Do you hear the sound? Okay. Do you hear the sound? Okay. And do you hear the sound? Okay. Do you hear the sound? Okay. And now I want you to tell me where the sound sounds like it's coming from, okay? Point to where you think you hear the sound. Do you hear it? Okay. Do you hear it? Great. Do you hear it? Great. Do you hear it? Great. So it seems like the sound of your ears seems to be working pretty fine. You can open your eyes now. So now what I'm going to do is I'm going to examine your ears, okay? I'm going to turn on the light and I'm going to tell you which direction to look, and I'm going to just take a quick look into your ears, okay? Okay. Let me turn on the light. Is the light too bright for you? Great. Could you please look left for me? Great. So now I'm just going to take a look inside your ears. I'm seeing that your ear canals look very clear, earwax. It doesn't look red or inflamed. I can see your tympanic membrane. It's pearly gray. It doesn't look to be in pain. All right, that ear looks wonderful. Can you turn your head to the other side for me? All right, and now I'm just going to take a look at this ear as well. All right, as I am looking inside your ear, it looks to be pretty clear of earwax. It doesn't seem to be red or inflamed. I can see your eardrum. I see the tympanic membrane. It is pearly gray in color. There doesn't seem to be any fluid behind your ears. All right, that eardrum also looks great. So while I have this light out, I'm just going to quickly look at your nose. Can you tilt your head up for me? Great. Now let's take a look. Your nose is clear. The mucosa is nice and pink. You have no damage or bruising. No indications of what would be a cold. All right, great. And now, can you open your mouth nice and wide for me? Great. I am going to look at your teeth. Good. And your tongue looks nice. Your gums are pink. You don't seem to have any damage. All right. That was great. I'm going to put the flashlight away for right now. We are going to come back to it. Let me turn it off. All right. So the next thing that I would like you to do is we are going to test your eyes and your different cranial nerves, okay, to make sure that that is all working and in order to figure out where you are having all of this pain from. All right, so you see my finger? Could you please follow my finger? Try not to move your head and just follow it with your eyes, okay? Great, you followed my finger very well. The next thing that I would like you to do is I would like you to just raise your hands when you see my finger come into your peripheral vision. So when they're on your side, not in front of you, but the side. Got it? Okay. Do you see them? Great. Great. Do you see them? Great. Great. Do you see them? Great. The next thing I want you to do is when my fingers come into your vision, so when you see them in front of your eyes, I just want you to raise your hand, okay? Ready? Here we go. Great. 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 Do you see them? Great. And do you see them? Great. So the next thing I want you to do is I'm going to wiggle one of my fingers and I would like you to tell me which finger is wiggling, okay? Ready? Here we go. Good. 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 Great. Great. You did that great. So now we're going to do a nose to finger test, okay? And what I want you to do is I want you to point at your nose and then to my finger, okay? Ready? Here we go. Good. 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 Great. Good. Good. Great. Wonderful. You did an amazing job. So it seems like your hand-eye coordination is good. Your tracking is good as well. And you aren't having any problems seeing things come in and out of your vision. All right. So what I am going to do is I'm going to bring out my handy dandy flashlight again. And we're going to take a look at your eyes. So the first thing I'm going to do is I'm going to just look at one of your eyes, okay? I'm going to put my hand over one and I'm going to look at the other. And I just want to see how well your pupils dilate and constrict, okay? Here we go. Nice. Okay. Let's do the other eye. Great. And now I'm going to swing. This is called the swing test. I'm going to swing the light into each of your eyes and I want to see how your eyes work in correspondence with one another, okay? Here we go. Great. Good. Great. Good. Great. Good. Great. Good. No, your eyes work pretty well. Now I want you to look into the light and I just want you to follow it, okay? Follow where the light goes. Follow the light. Follow the light. Good. Follow the light. Good. Follow the light. Great. Follow the light. Good. Follow the light. Great. Follow the light. Wonderful. Okay, you follow the light pretty well. The next thing I'm going to do is I want you to just stare at the window, okay? And I'm going to look for your red light reflexes. So just focus on that point right there. And I am going to look in your eyes, okay? Good, good. Nice. I see the red light reflex in this eye. All right. And now I just want you to stare at the chair behind me, okay? Good. Over here. Right there. Okay. Stare at the chair behind me. Great. That is perfect. All right. All right. So the next thing that we're going to do is a sharp or dull test, okay? And so I'm going to touch your face with my hand and I'm going to touch your face with the flashlight. My hand will be dull. The flashlight will be sharp. Now, I want you to point to which one you think it is. So close your eyes for me. All right. And raise both of your hands if it's sharp and one of your hands if it's dull. Okay? Here we go. Sharp or dull? Good. Sharp or dull? Good. Sharp or dull? Good. Sharp or dull? Good. Sharp or dull? Okay. Sharp or dull? Sharp or dull? Sharp or dull? Sharp or dull? And sharp or dull? Okay, so you can open your eyes now. So you did get a few of those wrong, which does have me at a little cause for concern. I'm starting to lean towards that you might have a concussion, okay? And so to test that, I'm going to test some more of your cranial nerves, okay? So as I'm touching your face, I'm going to try to push you to the opposite side. I just don't want you to let me push your head, okay? Here we go. I'm pushing and pushing and pushing. Oh, okay. And now let me remove this flashlight. Okay. And now I'm going to do the same thing with this hand, okay? And I want you to just not let me turn your head. Ready? I'm pushing and pushing and pushing. Okay. Now, put your hands in mine. Good. Now, I'm going to push up on your hands and I want you to stop me from pushing down. Ready? From pushing up. Here we go. I'm pushing and pushing and pushing. Great. I'm going to push down on your hand and I want you to stop me from pushing down. Ready? I'm pushing and pushing and pushing. Great. And now, can you do this with your hands? Just like that. Okay. I'm going to pull your hands forward and I want you to stop me from pulling your hands forward, okay? I'm pulling, I'm pulling, I'm pulling. Good. All right. So that seems pretty fine. Can you puff your cheeks out for me? Now I'm going to pull your smile down and I want you to stop me from pulling your smile, okay? I'm pushing, I'm pushing. Great. And now you can relax your face and close your eyes, okay? Great. I'm going to try to open your eyes, and I want you to stop me from opening your eyes, okay? I'm pulling, I'm pulling, I'm pulling. Great. That is pretty good. So, have you hit yourself on the head recently? You have. And was it very hard? Okay. And when you hit yourself on the head, did you feel any pain here where you hit it? All right. So, based off of what you said, I'm going to take a look at your head, okay? And I'm going to check your scalp for any lumps and bumps, all right? Can you bend your head towards me, please? Good. So, now I'm just checking your head for any lumps, for bumps, for tenderness. If I press here, does that hurt? You can raise your hand. Okay. If I press here, does this hurt? Yes. Okay. So I'm just going to look here. It seems that you do have quite a large bump here. I'm just going to palpate all the way around. Palpate, 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 palpate. And does it hurt anywhere else as I'm palpating? Okay. So, what I think has happened is I think you hit your head and you gave yourself a bit of a concussion, okay? So, what I would like to prescribe you is, some Tylenol pain pills to help you manage the pain, and we will check on your condition, okay? Concussions normally go away with time, but if it does get worse, that means that there could have been some brain trauma, and in that case, I would like you to come back, okay? And we will do more tests to make sure that everything is okay. But for now, it seems like you have a soft concussion. It doesn't seem to be very serious. So we'll keep watching your condition. All right. Thank you so much for coming in today. I'm glad that you got your head checked. And the nurse will be in with your discharge papers. And I'll see you later, okay? All right. Have a great day. Goodbye.